You walk past them all the time. That spinning cylinder of red and white stripes outside the neighborhood barbershop, it's such a common piece of storefront decor that we almost never stop to ask why it looks like that. The design is actually a literal advertisement for the services once offered inside. The red stripes stand for blood, and the white stands for the bandages used to soak it up. Today, you go to these shops for a quick trim or a shave, but for centuries, stepping into a barbershop meant bracing yourself for crude, necessary surgery. During the European Middle Ages, the science of dental health essentially did not exist. There were no formal dental clinics or universities training specialists in oral care. For the average person, professional medicine was completely inaccessible. This made a simple cavity incredibly dangerous. Without modern antibiotics, an untreated toothache could easily spread, swelling into a systemic infection that could kill you. When the pain became unbearable, villagers were forced to seek out anyone capable of applying enough blunt force to rip the rotting tooth out. That high demand for immediate physical relief created an opening. Someone in the village had to perform these extractions, and the job fell to the people who already held the right tools. The local barber became the de facto dentist simply by default. They were the few members of the community who regularly maintained extremely sharp forged metal. The instruments they used every day to shave beards and trim hair, like straight razors and sharp scalpels, were repurposed for slicing gums and extracting teeth. Because medical specialization hadn't taken hold, the line between grooming and surgery blurred entirely. These tradesmen adopted the title of barber-surgeons. If you sat down in their chair, the exact same unsterilized blade used to give the previous customer a close shave might be used to dig an abscessed molar out of your mouth. Woodcuts from the period document these exact scenarios, depicting practitioners prying teeth from the mouths of visibly distressed patients right in the open. We look at this today and see horrifying malpractice, but for hundreds of years, this was the absolute highest standard of care available to the public. The interior of a 15th century barbershop was a chaotic mix of services. You could walk in for a haircut and sit next to someone receiving a bloodletting or a wound suturing. To advertise these medical services to an illiterate public, barbers would take the bloody white bandages they used during procedures, wash them, and hang them outside to dry. The wind would twist them around a post, creating that distinct spiral pattern. Their surgical responsibilities frequently expanded well beyond pulling teeth. Barber surgeons were drafted into military service, where they became the primary medical personnel treating severe lacerations and amputations on the battlefield. In an era largely devoid of specialized physicians, these tradesmen served as the necessary frontline guardians against infection and decay. The dominance of the barber surgeon eventually waned as the broader scientific community began to map human anatomy and understand how infections actually spread. Physicians recognized that performing invasive surgical procedures required rigorous academic study, completely separate from the skills needed to cut hair. The professions formally split. Dentistry emerged as its own distinct medical specialty, with strict training requirements. Laws were passed that restricted barbers to cosmetic grooming, officially stripping the surgeon title from the local shop. The sterile, painless dental clinics we rely on today are the endpoint of a very long climb out of that medieval medical vacuum. Step inside a brightly lit modern barbershop, and you'll find a highly sanitized environment dedicated strictly to keeping people looking sharp. We no longer ask the person fading our hair to stitch up our wounds or pull our molars, but the origins of the profession are still commemorated right by the front door. Those rotating stripes remain a fixed memorial to the long era of the barber-surgeon. It stands as a daily reminder of our medical evolution, spinning quietly on street corners, hiding a history of blood and bandages right in plain sight.